Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the Health Department admits that over 31 million COVID-19 vaccines have gone to waste, but claims these numbers are still within the allowable range. OCTA Research Group sees a new uptick in the new COVID-19 cases. How is government preparing ahead of the holiday season? And later, the fate of the COVID-19 alert level system and the state of health emergency. Health OIC and Undersecretary Rosario Vergeire joins us in the program. Former Health Secretary and now Iloilo Representative Janet Garin says that the Health Technical Advisory Council, or HTAC, which advises the Health Department on vaccines, should also be blamed for the wastage of around 31.3 million doses of COVID-19 vaccines. Garin laments the delays in the recommendation of vaccines. She slams the council's failure to act swiftly on vaccine review, but the DOH said that the more than 31 million wasted doses of COVID-19 vaccines are still within the acceptable levels set by the World Health Organization. Let's go straight to the source of the story. We have Health Officer in Charge, OIC, Rosario Vergeire. Usec, good to have you again. Welcome back to the source.
Magandang umaga po, ma'am. Good morning po to all of you.
So 31.3 million doses were wasted. That's equivalent to 12.5% of the vaccines. Siguro definition of terms first, Usec. When the word wasted, pag sinasabi pong wasted, ano ibig sabihin ito? It can no longer be used? Ganun ho ba yun, yung 31.3 million?
The term wastage would comprise of two components first. There would be operational wastage and there would be this wastage because of expiring doses. The expiring doses would total around 24 million plus, and those that were included as part of the operational wastage would be 7 million plus. Operational wastage would be because of temperature excursions, because of the calamities, opened vials na hindi po naubos. And then when we talk about this wastage, meron pa rin pong mga ibang bakuna dyan. We quarantine them because we are still awaiting for our request for their shelf lives to be extended.
Okay, so thank you for that. I was thinking about, possible causes of the wastage of the vaccines because as you mentioned a while ago, nandyan po yung bagyo, nandyan po yung hindi din na-deliver, I guess, logistics concerns. And then, of course, the bulk of this really is the expiration at 24 million. Ito pong expired vaccines, Usec, how many of these actually can still be used or hinihintay pa po yung recommendation from the manufacturers for an extended shelf life?
Well, there would be around 10% of this to 15% that we are still awaiting for the request for extension.
Okay, so that's about 2.4, maybe to about 2.7 million vaccines. That could possibly be extended, the shelf life. Is that correct, ma'am?
Yes, ma'am. But up until now, we have not received any response from the manufacturer yet.
Does it look like malabo na po yan? Kasi they're already expired and you have asked for an extension of the shelf life and yet until now, wala pa rin pong sagot. So more likely ho ba, would you say that the 2.4, 2.6, 2.7 will also be part of the hindi na magagamit na bakuna, ma'am?
Well, we have done this in the past, in the previous vaccines that we have, which were extended. Actually, our requests were submitted already, even prior to the expiring of these vaccines. But as I've said, up until now, no response yet. I guess we still need to wait for that. Even if there would be just this slim chance, sayang pa rin naman po kasi.
Opo, kung biglang payagan at posibleng magamit po natin, sayang din naman po yun. As you mentioned, I was going to say that yes, in the past, humingi na po tayo ng extension ng shelf life at nagamit naman, nabigay naman po ito in the past. So, what happens now, Usec, to the vaccines that are considered wasted? Where are they stored and what is the plan? Ano ho ba ang gagawin dito? How do you dispose of this?
Well, we have this third-party logistics. That's part of our processes, whereby these third-party logistics are the ones responsible to dispose of these vaccines. Those that we have used already, yung mga hindi na ubos sa vial, pati na rin pong itong mga nag-expire.
If you were to look into the possible regions on which region would have the most number of wasted vaccines, which regions would these be?
Well, these are the big regions, ma'am. We have Region 5, we have Region 3. We also have expiring doses here in region in NCR, though hindi ho ganun kataas din, ano? In Region 7, also in BARM.
And then, I also wanted to ask you about ito pong pag sinabi ho kasing malaking balita din ho kasi lumabas ito yung 31.3 million. Usec, is this government procured, including LGU procured, including businesses procured? Please define.
Yes, ma'am. So when you try to look at the disaggregation of these 24 million expiring doses or expired doses, about 1.75% only was the procurement of the national government. Around 70% would be coming from the procurement of both both private sector and local government. Around 10 to 15%, I think, would be coming from donations.
I see. Okay. In other words, I'm asking this because if you look at the 1.75% procured by government, dito po sa 24 million that has expired, it seems mukhang maliit naman po itong 1.75. Kasi although meron pong 70% na malaki, which is the private and the LGUs. Going back again, to when we were trying to procure the vaccines. National was trying to procure, and then hindi ho ba LGU was also in partnership with the National, was also trying to procure their own vaccines. So, in other words, ma'am, hindi ho ganun kalaki yung sa ginastos ng gobyerno na nasayang na bakuna?
Yes, ma'am. Kasi pag tinignan ho natin, this would... let's go back to what happened to us during the time that we started procuring the vaccines. We started our negotiations since 2020, around November of 2020. And then when we were able to finally had these agreements, nag-umpisa pong dumating ang bakuna, donation muna yung Sinovac that was in March of 2021 tayo nag-umpisa. During this time, yung mga deliveries natin, hindi pa ho dumadating. Dumating ho ang deliveries ng bakuna ng national government procured. May, I think, was the first delivery, June, July. During this time, local government and private sector were requesting already from our vaccine czar that they will procure. There was this advice from the national government na wag na kayo mag-procure kasi ibibili naman ng national government lahat ng ating population dito. But of course, they would want to reserve some for their employees, their constituents, so they proceeded with their procurement. By the time na dumating yung deliveries natin, nabakunahan na natin kung sino po yung mga priorities natin noon. At naisama na rin most of their employees, most of their constituents. So by the time dumating ang deliveries ng private sector at local government, halos lahat ng bibigyan nila dapat ay nabigyan na. So ganun po yung naging story. That's why maybe meron pong ganito talagang excess from their stocks.
And how much would you say this would equate to, this 1.75% na binili ng gobyerno na nasayang na bakuna?
Well, kapag tinignan ho natin, we are looking at around, ang estimate lang po natin, yung pang presyo na ginagamit natin across the board, across all of these vaccines would be 500 pesos. It's around 1.1 billion.
1.1 billion. Ito lang po yung 1.75%, ma'am?
Yes, ma'am.
So mataas din pala, umabot din ng 1.1 billion pesos. But obviously, Usec, ang laki po ng nasayang din doon sa private at sa LGU because this is 70% of the wasted vaccines.
Yes, ma'am, malaki po. Actually, during that time, I think that was August of 2021, we already communicated them that if they are amenable, they could already identify a local government that they can already donate itong kanilang mga doses since nakita natin na marami pa sila sa stock sila because we were able to cover already those that they wanted to cover. But unfortunately, naging slow itong process na ito at hindi masyado nagkaroon ng uptake.
Yeah, and if I'm not mistaken, way back, looking back, Usec, yung alam kong ino-order noon ng LGU was mostly AstraZeneca. I think it's because it was one of the more reasonably priced vaccines around that time. All right, so again, you were saying that some groups obviously unhappy with this kasi pag tingnan naman po, napakalaki talaga ng 31.3 million doses, but sinabi mo 1.75 lang ang ginastos ng national government. But of course, the LGU, pera din naman po ng gobyerno yon, hindi ho ba? Pera din ng mamamayan yon. So, but in terms of kayo sa DOH, umaabot po sa 1.1 billion yung pong wasted vaccine. Tell us, the 25 to 30% that is supposed to be allowable in terms of, or acceptable rather, for vaccine wastage, bakit ho that is, I know that's coming from the WHO, but hindi ho ba medyo mataas ito?
Yes, ma'am. Actually, pag tinignan natin talaga, wala naman talagang set or ideal standard because it would depend on situations. Yun pong 10% na naunang sinabi dati, this was just a precondition of COVAX facility na dapat ang wastage mo hanggang 10% lang. Kaya nung una, yan talaga yung ginagamit natin. Of late, WHO was recounting what's happening across the globe. Because it is not just the Philippines having this kind of situation. You can see this kind of situation in all countries, especially those big countries which have procured a lot of vaccines. So kaya po tinatag or pinipeg at 25 to 30 because this is the experience across the globe. Especially those big countries, talagang malaki po ang kanilang wastage.
The question now is, where could we have done better? And should the HTAC also be blamed for this? But we need to take a very short break. We will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our source today, Health Officer in Charge, Undersecretary Maria Rosario Vergeire. So Congresswoman Garin was saying that some of this wastage could have been avoided and if there was probably more expeditious action coming from the HTAC, such as, ayan po, sinasabi na nga niya na every decision of the DOH has to pass through the HTAC. And I think further on, the Congresswoman was saying that ang bagal ho daw siguro nung pag-recommend, especially doon sa first booster shots. Just a reaction on this, Usec.
Yes, ma'am. First, I think it's unfair that we accuse that the Health Technology Assessment Council is to be blamed or for this kind of issue that we have right now. Pag tinignan ho natin sa kabuuan, marami ho talagang factors which led to this kind of wastage. But primarily, kapag tinignan natin, if we were to go back, we would still do the same. Because nung nag-uumpisa po tayo, all countries were scrambling to procure this vaccines because there was this scarcity. Kaya lahat tayo, kung ano man negotiation ang naandyan, talagang in-order natin because we would like that all Filipinos will receive these life-saving vaccines. Dumating tayo sa point na yun pong ating mga bakuna, yung deliveries niya, kahit na pumasok na tayo sa negotiation, hindi naman lahat po sabay-sabay pumapasok. So habang ginagawa po natin at nag-aantay tayo ng deliveries, FDA, our Health Technology Assessment Council, our experts had been working hard para po for us to generate evidence and we can already be able to provide the guidelines for this vaccination. So I think there was really no one to blame na specific. Unfair din po na ma-blame natin yung ating mga experts. They did their job. Lahat po ginawa natin expeditiously. It's just so happened na evidences were really not that complete then. And our experts cannot be forced to decide kung hindi naman po kompletong ebidensya.
Dahil, in the end, they will be blamed?
It's not really to be blamed, but our experts will decide based on evidence. They cannot decide na sasabihin nila because government or the public already wants it and then kailangan na natin ibigay yung bakuna na yan.
Yeah.
Kailangan, tinutulungan kasi nila tayo to ensure that when we give these vaccines, these are going to be safe and it's going to be effective for our population.
And any decision that is made by the HTAC, who's been with us all this time, is really based on evidence that they receive, Usec. Hindi po yung dahil ginagawa na po sa ibang bansa, dapat gawin na rin po natin.
Yes, ma'am. Partly, ginagawa na sa ibang bansa, malaking bagay yun. Nakakapagpabilis yun. Ginagamit po nila yun kung ganun. Kaya lang, meron pa rin mga ibang ebidensya rin naman tayong kinakalap para mabuo yung ating evidence base para we can decide properly. So, the Health Technology Assessment Council, kompleto po ang experts natin dyan from economics to ethics to sociology to these vaccinologists, lahat po yan. So they use this process for them to give positive recommendations to the government at para naman po ang DOH guided din sa mga desisyon natin.
Right. And of course, alam naman po natin, Usec, that nobody expected really this COVID-19 and that, kumbaga, marami po talagang nabulaga dito sa nangyari. Looking back though, kung babalikan po natin, of course, everything in hindsight, what could have been done better? Do you actually reflect sometimes and say, we could have improved that in this way or on this area or this factor?
Marami po tayong learnings sa nangyari dito sa pandemya in terms of vaccine procurement. Unang-una, gusto ko lang sabihin na kung babalik po tayo dun sa unang-unang time na bumibili tayo ng bakuna, hindi ho natin babaguhin na tayo ay titingin sa lahat ng sources para mabigyan natin lahat ng taong bayan. Siguro, ang kailangan lang talaga mag-improve would be, of course, our logistics and distribution. Kasi kapag dumadating na po yung bakuna dito, nandyan po yung expeditious distribution. Kaya lang, syempre, may mga lugar tayo na medyo malalayo talaga na bago makarating ang bakuna ay talagang challenge for us. The second one would be that our inventories should always be regularly done and on time. Para alam na natin, we can be able to flag, may mag-expire na dito, i-reallocate na natin sa ibang lugar. We have done that, pero syempre, lacking pa rin siguro at konting improvement pa po.
And I guess one issue I wanted to ask you, Usec, is that ang lahat ba ho ng bakuna, of course, depende po sa manufacturing date, yung kanilang expiration date ho ba is the same no matter the manufacturer?
Hi, thank you for asking that, ma'am. Kasi yan po ang isang naging issue natin during the start that we have procured and the start of the vaccine production of these manufacturers. Napakaikli po ng shelf life ng lahat ng bakuna. Nasa 6 months lang or less. Kaya talagang pag dineliver dito, kailangan gamitin agad para hindi mag-e-expire. Hindi po lahat ng bakuna ay pare-pareho ang expiration. Meron pong 6 na buwan, meron naman pong 12 months, meron naman pong mas matagal pa dyan. Ito na lang po, itong of late na, tsaka nagkakaroon ng mas mahahabang period of shelf lives. Pero as I've said during the start, lahat yan halos 6 months or less lang po ang kanilang expiration or shelf life.
I see. Usec, let's talk about the bivalent. Habang pinag-uusapan na rin po natin ang bakuna, yung bivalent vaccines. I think the last time we spoke, you said that let's look into to manage expectations, possibly first quarter of 2023. Tell us about the progress of talks at if ever, sino hong manufacturer ang posibleng magpasok or kumuha po tayo ng bivalent vaccines?
Yes, ma'am. There are 2 manufacturers actually of these bivalent vaccines. We have Moderna and we have Pfizer. We already started our negotiations around 2 months pa from today. And for Moderna, we already were able to submit our term sheets. We were able to also have discussions already on when they can be able to deliver as soon as we sign and have the process na mag-move na po. So right now, ang ginagawa po natin, we're just waiting for the Emergency Use Authority coming from the Food and Drug Administration. Ang HTAC po, halos tapos na ang kanilang ginagawa. Inaantay na lang na lumabas ang EUA and we can be able to issue already also yung HTAC po.
Yeah.
And then kailangan lamang po natin talaga yung parang special authority that we need so that we can go through the negotiations and finalize. Ang Moderna committed that they can deliver as early as December. Kung lumabas na ho yung EUA, itutuloy na ho natin yung negosyasyon.
Okay.
For Pfizer, we have already signed our CDA, and ito na lang po, mag-uumpisa na rin tayo ng pag-uusap with them.
All right. Again, we need to take a very short break. We will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb, our source today. Health OIC Maria Rosario Vergeire. Just quickly on COVID numbers, Usec, Metro Manila increased this recent week positivity rate up from 7.4 to 9.2 rather. So that's almost about 4% increase. Are you seeing the same numbers? Because I got that from OCTA, and this is concerning.
Well, yes, we are. But as we always say, let us not only use positivity rate when we do our analysis now. Medyo skewed po kasi kapag yung positivity rate because it is affected by a lot of factors, especially now that people prefers to use antigen test rather than the RT-PCR. So medyo kulang po yung may bibigay sa atin na kapag iyan lang ang gagamitin. And also, we would like to have that shift in mindset wherein oo, alam po natin expectedly cases are increasing or will increase or will be there. But what would be most important would be our hospitals and our healthcare system. As long as it is manageable, as long as we keep our severe and critical at that minimum level, we are okay.
And what's it like now for the hospital care utilization? Still low?
Yes. It is at low risk. All of the regions have low risk utilization. Meron po tayo ngayon na issue naman sa non-COVID wherein we're having around 70 to 80% occupancy sa mga ospital natin because of non-COVID cases.
Right. Also, that's why I wanted to bring this in, Usec. Yung pong sa pag-usapan po natin, yung sa National Kidney Institute, there are problems right now. And in fact, they've asked for help from the DOH. They need more personnel, nurses included. Hindi na ho sila nakakatanggap ng mga pasyente. Kaawa-awa po yung mga pasyente. Please update us on this. What's going on? I saw an interview that you said that some of the patients have been moved to Tala and I believe East Avenue.
Yes, ma'am. Actually, the moment that ED Liquete posted that advisory, we immediately called her and told her that she should advise us because we can manage that naman internally. But anyway, we went there and we saw the situation. Meron ho silang limitadong pagtanggap ng mga pasyente, especially if patients will need to undergo dialysis because ang dami na nga hong pasyenteng naka-admit sa kanila. So they opened up their gymnasium. Meron ho tayo doon mga extra dialysis machines na pwede gamitin. Kaya lang ang kailangan talaga manpower. So we immediately called PNP and AFP and immediately naman po rumisponde. Magpapadala at i-deploy nila yung kanilang healthcare cadre sa NKTI para makatulong. These would be nurses and doctors. Also, we asked help from our other hospitals and they also have responded. And yung pong mga ibang ospital naman na maaring tumanggap para ma-unload natin ng NKTI, ang Tala po at saka ang East Avenue responded already. The other hospitals, they are just trying to unload some of their patients na pwede na para rin po makatanggap ng pasyente.
But what happened, Usec? Bakit ho biglang well, this is not the first time. I do recall sometime in the past no, na napuno din to. Pero any underlying reason why this happened recently again at the National Kidney Institute?
Well, for now, we're not just looking at the non-communicable disease factor, no? Yung may mga end-stage renal disease na nagpapadialysis. Ngayon po kasi nasama pa yung leptospirosis cases. Naalam po natin kasi tag-ulan, mas dumami yung kaso nito. So medyo additional burden po yan para sa NKTI. But we're trying to manage and we're trying to set up more dialysis facilities in the country para po hindi lang NKTI ang pinupuntahan ng ating mga kababayan.
Right. Very quickly also, National Children's Hospital, Senator Raffy Tulfo wants part of the budget from the DENR realigned to the National Children's Hospital. Sabi niya po, kaawa-awa daw yung ospital doon. Plywood na lang daw yung ginagamit na pangtakip sa mga bintana, pumapasok daw usok, lamok, etc. Pati daw yung therapy center, kalahati lang daw ng CR ng Senado. Tell us, number one, definitely, would this be a welcome development for the DOH sakaling mailipat po yung ilang pondo sa Philippine Children's Hospital?
Ay, syempre naman po, no, kung ano man pong tulong ang matatanggap natin para mas maipaayos natin ang ating mga ospital, kami po, no, that's an opportunity and we say thank you. Ito naman pong ating mga ospital na to, year in and year out, meron po silang mga budget. If they need a budget for repairs, they have their MOE that is being provided for by the national government through DOH. Meron din po tayong Health Facilities Enhancement Program na nakakatulong din po sa kanila. One of the problems of the National Children's Hospital is the space. Yun pong kanilang space, no room to expand na po dyan kasi sa ospital na yan dahil nga po masikip na yung kanilang lugar. Kaya po isa po yan sa tinitignan natin, kaya hindi rin po tayo set up masyado ng improvements as to additional building so that we can unburden or unload this current building that they have.
So let's see, Usec, kung sakaling may mailipat pa na pondo sa ilang mga ospital under the Department of Health. Health Officer in Charge, Undersecretary Maria Rosario Vergeire, ma'am. Thank you, as always.
Maraming salamat po.
Thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.